Hello, folks. We are checking that we are live. I think we're good. So, welcome. It's June. It's Migraine and Headache Awareness Month, and I've got an exciting interview that I know will offer you fresh perspectives on how you think about headache and migraine disorders. If you're a fan of the Curable app, of Alan Gordon's book, The Way Out, or simply fascinated with the neuroscience of pain, you will find today's interview with Vanessa Blackstone, the co-executive director of the Pain Psychology Center, incredibly mind-blowing and fascinating. If you're joining us for the first time, this is a weekly live stream every Wellness Wednesday. I bring you interviews, yoga practices, and wellness talks all about migraine and wellness. I come here every Wednesday at 2 p.m. Eastern in the Yoga for Migraine Facebook group. If you don't know me, my name is Adrienne Delorco. I am a yoga coach and founder of Yoga for Migraine. I've been living myself with migraine for 15 years and thankfully have recovered from a long bout of chronic migraine by focusing on both lifestyle and mindset strategies that I now teach to my own clients in my group coaching program Beyond Migraine. So one of those essential strategies that I help clients with is called Pain Reprocessing Therapy, and it's a practice that I got certified in last year with the Pain Psychology Center, and Vanessa Blackstone was one of my main trainers, and so I'm so honored and thrilled that she agreed to talk about Pain Reprocessing Therapy, aka PRT, and migraine specifically with all of us today. So to introduce Vanessa Blackstone, ACSW, is the co-executive director and psychotherapist at the Pain Psychology Center. In addition to treating patients, she trains new clinicians and provides consultation to medical providers on the methods of pain reprocessing therapy. So she trains other experts on how to do this. She works with individuals, couples, and in addition to PRT, she specializes in sex therapy and mindfulness-based relapse prevention. And on top of all that, she is a motivational speaker and intimacy coordinator on film sets. That's like a whole new interview that I'd love to learn more about someday. And mentors first-generation college students at the University of Southern California. Vanessa, welcome. We're so happy that you are here.
Hi, I'm so excited. Thank you for bringing me.
Well, so looks like we are here. Thank you all for joining. And if you are joining us live, I invite you to write #live or tell us where you're from in the comments. Great to have Jennifer and Debbie here. And to interact with us. Like, you're welcome to drop any comments, questions. Vanessa is going to answer questions that some of our community members already asked, but if you've got fresh ones that come up, feel free to drop them in the chat as well. And if you are watching this later, drop #replay in the comments so that it just helps boost the algorithm so more people can watch this video and learn. So let's dive in, Vanessa. Before we get into the nuts and bolts of like what PRT work is and how it works, I'd love for our viewers to also hear your personal story of chronic pain and migraine specifically, and what helped you overcome so many of the health challenges that you once dealt with.
Yeah, it's long. So when I was about 11 is when I started developing migraines. They first showed up as light sensitivity migraines and then started moving to aura migraines, where I'd be triggered by like certain sounds, light sensitivity, smells, even like pressurized things on my head. Like I never used to be able to wear a hair clip before if I started a day, or especially if I had a migraine. And then from 12 on, especially after menstruation, I started developing pretty significant pelvic floor pain. Think of the course from 15 to 30. I've tried maybe 14 different birth controls. And then at the age of 18, I developed chronic hives during stress. And then in grad school, migraines led to neck pain, and then kind of graduated into then vertigo if I was like sitting in a grad school class and starting to have symptoms of a migraine. the vertigo would get really bad. It felt like my eyes were shaking back and forth. And sometime around grad school as well, I don't think that's a coincidence.
Right.
I started struggling with some IBS, and I've always really had a hard time of prolonged symptoms post injuries. So post broken bones, post concussions, post any other kind of injury, I just would have like very long recovery period.
Oh my goodness. So
Wow. Yeah.
chronic pain's not just a concept for you. I mean, you've lived this, you've experienced this, and I take it now things are better. How did you get to the point, where you are now, where you're able to manage all this,
Yeah.
decrease it?
Um, I haven't had, oh gosh, I haven't had any chronic pain symptom for maybe about 3 years now. I do get
Wow.
hives every now and then, but I'll talk more later about how to listen to those cues and lean into it like a superpower instead of looking at it as something incredibly debilitating. So I do get that symptom, but what really kind of helped me overall is first and foremost changing my perspective on the symptoms that I was experiencing to teach myself to respond differently. What really helped is texting Alan frantically and making him call me so I could talk to him about what was going on. So that was interesting. But really, I mean, it sounds so cliche, but what really helped me was actually our work, PRT, and just realizing that we have more power than we think we do, and
Mm.
how to really learn how to lean into that power.
Yeah, I love that concept that learning about how our brain works, like instead of, yeah, feeling like this is just how it is, how we're just stuck with this condition, that there is so much in our power that we can do to minimize our pain. So, yeah, walk us through how, just the science of how we experience physical pain in the brain and body. I kind of kept teasing at this idea, like, is pain all really in our head? A lot of people maybe feel a little bit like taken aback, especially in the migraine community. Like, what? We're just making this up? Like, give us some insight of what is going on when we experience physical pain and what the brain is doing.
Yeah, I love that phrase, is pain really all in our head? Because I like to twist it a little bit to have it feel more validating. So, yes, pain is in our head. However, pain is in our head in the way in which our brain processes pain and sends that signal to our body. So, the example that we like to use is your hand on a hot stove. So when you place your hand on a hot stove, it's actually not your hand that is hurting. It's your brain sending the signal to your hand that says, you're hurting yourself, take your hand off the stove. And then we take the hand off, right? So all pain is processed in the brain. The example that I really like to use too is a different kind of, excuse the puppy, she's
Oh no,
letting
we
her
love the
explore.
puppy.
Okay, okay. She's exploring. The example that I like to use is something called CIP, congenital insensitivity to pain, is a very rare diagnosis in which an individual actually doesn't experience pain because their brain is not sending them the signal. So their life longevity is actually cut in about half because they do not know their own physical limitations. I like to use that example so that we know, oh, yes, okay, so if somebody doesn't have pain, it actually really harms them long term, and how important that is to know. Um, Pain is so interesting, and the way that we get signals to our body. Your brain is not worried about getting it right. Your brain knows one of two things: are you safe or are you unsafe? And that can look differently based on the situation. So being emotionally safe or unsafe, being physically safe or unsafe. This is where our brain gets a little tricked up, is that it's trying to tell the difference between what is actually happening, taking the external information it knows and processing it in order to send signals to the body. So if you're walking down an alley late at night and it's dark, and somebody's walking up closer and closer on you, and you feel them getting closer, and you know that you're alone, you know that your phone has died, you know that there's no one around, and you're starting to panic. You might have your heart palpitating, you might start sweating, you might start shaking, your eyes might start tearing up. You might not know if you want to run or if you're freezing, and so your nervous system is turning on and you don't know how to act fully in that moment. Or you might be speaking in front of a group of your peers. Scary, we know that's a top fear, right? Amongst, I think it's like public speaking, dying, and like financial stress is like the top fears. So if you're speaking in front of a group of your peers, your heart starts palpitating, you start shaking, your eyes are watering, you can't focus, you feel like you don't know where you are, you're getting dizzy. The symptoms might actually look the same as that of being in a physically dangerous situation because your brain is just trying to prioritize keeping you safe. So, in a way, in a funny, more empowering way, it is in our head, but we are not making it up. It's your brain processing the signal and sending it to your body.
Yeah, and it's about our brain's opinion, right? Is sending how much pain to bring on or not, and then and it's doing this to protect us. I mean, that's an important thing. That's not our pain signals are there ultimately to protect us, and sometimes, right? It's maybe that'll segue good to the idea of neuroplastic pain. Sometimes the brain gets it wrong. It gets it into patterns where it's perhaps overprotecting us. So tell us about neuroplastic pain. Does it ever go by other names? I've heard of other names for it. How does that play into chronic pain?
Yeah, so neuroplastic pain results from the brain misinterpreting safe messages from the body as if they were dangerous. So, in other words, neuroplastic pain is a false alarm. Though the pain can be addressed psychologically, this does not imply the pain is imaginary. And the different names that we kind of use that have been floating, through the world of mind body work for some time. I think when I started, we were heavily using this term TMS, the mind body syndrome. And I know that other practitioners, such as like Dr. David Clark, he uses PPD, psychogenic pain disorder. So you'll hear neuroplastic pain, TMS, mind body, PPD. Those are kind of the other names that it goes by.
Okay, great. And is this in particular like something that happens with chronic pain, or how is this different than, if I get an injury or
Mhm.
something like that?
Absolutely. So, the difference between chronic pain and an injury, right, is that an injury needs time to heal. All injuries have increments of time in which they heal, right? That's why we follow up on them, we care for them, we continue to go to our doctor after you've broken your ankle just to make sure that it's healing okay, right? There are healing timelines. Oftentimes, like myself, when we start to see some sensations linger outside of that timeline and we've kind of checked all of our boxes of making sure that this has healed okay, we can kind of start to look at it through a lens of being neuroplastic. Now, of course, that doesn't happen right away. People aren't like, oh, I'm going to give myself 3 to 4 weeks, and then after that, it might be neuroplastic. We don't think that way. We continue to pursue any method that has us, healing on a structural basis because that's just how we're wired. Um, and so the difference between like that injury versus chronic pain is that chronic pain is the thing that starts to show up chronically, right? Long term, it starts to build various learned associations. We have certain behaviors around it that help soothe it, medications, regimens, avoiding things, lots of ways in which we treat it. And we kind of build this whole relationship with
Mm.
it. And it becomes like a toxic person in your life in a way. And so we address that toxic relationship with your sensations to be able to kind of recognize the power that you have, disempower the fear over the sensations themselves, and reprocess this pain as neuroplastic. Mm.
Good. So I think that's kind of going into really what pain reprocessing therapy is. Yeah, anything you want to kind of add to that, what some of the practices look
Yeah.
like if someone we're gonna to get
Yeah.
help with PRT.
Yeah, so some of the practices that we actually utilize, one of the biggest ones is somatic tracking. So it's a combination of mindfulness, safety reappraisal, positive affect induction. The purpose of somatic tracking is to help patients attend to the painful sensations through a distinct lens, thus deactivating the pain signal. What we are doing in PRT is looking at the fear inducing stimulus. So, with migraines, that fear inducing stimulus is, of course, the migraine itself. The migraines are interesting that it's a little bit even before the migraine itself. It's
Mm.
before the migraine actually happens. It's in around the variety of triggers that we experience, the stimuli that starts firing up the fear that continues to spiral the effect of the migraine itself. So PRT aims to rewire the neural pathways in the brain in order to deactivate pain. I like to say that PRT aims to rewire our reaction to the triggers in order to deactivate or reduce the pain of the migraine over time.
Okay. Oh, so much to go into. Well, I've got
Mhm.
a comment that might kind of connect to what we were talking about. Katerina posted, how to do somatic tracking with migraine. And I do remember, in my own training of PRT, there
Yeah,
are better times to do somatic tracking than others. Do you want to touch on that briefly?
absolutely. I actually have my own like unique focus using all the PRT things, all the wonderful things that Alan taught me. I have my own kind of approach to it, being that I can relate to a little bit, and I'll tell you why. So, yes, somatic tracking is wonderful. When the stakes are really high, it might be hard to somatic track because it's really hard to focus through a lens of neutrality, curiosity, patience, when we are just at an 8 or 9 out of 10 on the migraine scale, right? So, what I like to do with my clients, and honestly, what I like to do with myself, is focus on a few things that technically are versions of somatic tracking. Because somatic tracking is about changing the way in which we approach the pain. Sometimes it's really hard to sit in that exercise and listen to an 8-minute recording to approach our symptoms. So I like to break it apart a little bit and use it in various ways.
Hmm.
So, for starters, we are so preoccupied with our pain all the time. We're preoccupied about being preoccupied, and we're preoccupied before we are even preoccupied. So we're there in the migraine before the migraine is there because you experience it all day long. It's not just a minute moment of the day. A migraine is a full-time job, if not more, and that you don't get paid for it as well, which is a bummer. But the essence of this work is recognizing how preoccupied we are with this sensation. So I like to start with someone by getting to know their relationship with preoccupation around their migraine. How
Mm.
preoccupied are you? What does that look like? Tell me a little bit about some of the behaviors around your migraine experience and the triggers before, so that we can get to know how much of your day is around this thing.
Yeah.
So if you hear that, it sounds a little bit somatic tracky-y because it's a curious approach. Tell me about it. I want to know more about your migraine experience, right? And then I start to work with folks on prioritizing their own messages of safety.
Mhm.
It's so great to say things like, "You are safe, my body is okay." But sometimes the phrases in and of itself lose their zhuzh unless they're really something that relates to you. And
Mhm.
so I really like to work with my clients individually in creating their own messages of safety, right? A common message of safety, one that I even provide myself, is my body is whole right now. I'm not
Mm.
like a separate person because of my migraine. My body is whole. If I touch myself, I'm here. I'm not splitting in half, even if I feel like it, right? And so I myself will even ground myself by checking in that like my belly is here, my head is here. And if I touch it, it can actually feel nice, even though I might be sensitive to that too, right? And finding ways in which I can engage that in other ways. So I'm prioritizing messages of safety, leaning into things that really actually work for you, and
Mm.
creating kind of a foundation of that. Even to people that are listening, I would really encourage you to like look at things that you love and enjoy and find comfort in your life, and create a list of 5 things that sound really authentic to you, right? Like when I'm feeling unsafe, laying with my dog is the safest thing that I can do. And
Mm.
prioritizing that message and being able to do so, right? So I like to focus on preoccupation, prioritize messages of safety that are authentic to you, and being able to create something that feels good there. Making some light changes. That's a really big one. I have some clients that use migraine calendars. So they will mark the days in which they've had a migraine, mark the days in which they haven't. When we build a good relationship and we feel really great about our connection, I really like to encourage people, what would it be like for a week to not enter anything and just make a
Mhm.
little change? Like, oh, I can do that. Okay. And leaning into something that you feel kind of empowered by. It's new, it's scary, but what might it be like to try just a teeny little change in your routine? Something safe where the stakes aren't as high. We want to be careful about doing things like, oh, I'm just going to avoid all of my things that help keep me safe. No, we want to pick something small where the stakes aren't as high, something approachable, and something that'll, again, prioritize a message of safety to you. And the last thing, and this is kind of important and kind of funny too, is exploring worst case scenario, right? It can be important and really difficult to explore worst case scenario, because sometimes worst case scenario means, and this is what I did in grad school, is like, I'm going to fail out of school. I'm going to lose all of my opportunity. I'm going to owe all this money to the school. And then I'm going to have nothing. My life is going to fall apart. I'm going to have no money. I'm going to lose my apartment. All of these things. But if you really say that out loud, like, wait a minute, the timeline of all of that happening right now might not be as prevalent as I fear it is.
Mhm.
One time I had a migraine during a session, and this is when I was quite new in this work. And per usual, frantically texted Alan. I was like, can you call me? And he was like, sure. And we hopped on the phone, and I just like cried and just vented about having this migraine. And I feel like an imposter. And this is so bad. I was supposed to go on a hike after session. And Alan said, okay, worst case scenario. What if you went on that hike? I thought about that afterwards, because he didn't point on, okay, yeah, you're this horrible therapist. I'm like, worst case scenario, what if your clients hate you? You put that aside, because that's not important in that moment. It sounds to me like you want to go on this hike, and that's something that you can control right now. Worst case scenario, what would happen? I was like, I would throw up, because I feel like I'm about to throw up, which is a common symptom of a migraine for me. And he said, well, you're already outside, so it's not the worst thing if you throw up outside, because then you don't have to clean it up. And I was like, yeah, that's really gross, but like that actually makes sense. And again, it had me focus on this outcome that said, oh, I can prioritize this message that says, worst case scenario, I'll actually be okay on this hike. And I became less preoccupied of my migraine, right? And so I actually started to feel safer in my body. And I made a slight change that said, I'm going to do something, even though my fear says I can't, because the stakes aren't as high with this thing going on a hike. I have no idea when the migraine went away on the hike, but it did at some point. And that was the whole point. Letting go of the preoccupation so that we're no longer preoccupied, and we don't even realize the moment that we're out of that.
Yeah, I love that story because, right, living with migraine, we can feel like we end up curbing so much of our lives because we are nervous about getting triggered or we're already in pain. So I want to touch on that soon, but I also want to talk about a question that Dorgan asked, basically to the effect of, is migraine pure neuroplastic pain? Like, you know, in the migraine community, we think, oh, migraine is a genetic neurological disease. You know, there's physiological things happening during an attack. Like, is it different than other kinds of chronic pain? You know, from the PRT perspective. So, how do you see it? Is it pure neuroplastic? Is it mixed? Do we know?
Migraine is such a mystery. I mean, if we look up a lot of the research and treatment on it, the lack of clarity is so prevalent. And for us in pain reprocessing therapy work in the field of neuroplastic pain, when we see that something has consistently been such a mystery, or we struggle to understand the structural foundation, that already allows us to rule out for a diagnosis of a diagnosis with a structural foundation, and allows us to rule in for the heightened state in which the brain begins to send signals to the body based on triggers, based on learned associations, based on a variety of things that we know in this work. So we have this kind of rule in, rule out method that we use that really helps us safely see someone as a therapist for their chronic pain symptoms, especially migraine. So ultimately, with rule out, we look at a diagnosis that was given with no structural foundation. We also are curious if somebody received a diagnosis from a physician and that physician does not have familiarity with neuroplastic pain. We like to look at that as something that helps us go, wow, there's a chance that they didn't know about neuroplastic pain. So I wonder if they did, if they would consider a diagnosis of neuroplastic pain. Someone who's trained to look within their specialty and within their scope, they're just going to look within that scope, right? And of course, that's what we all do, you know? So, and another part of rule out is something that we call normal abnormalities. We all have abnormalities. All of our bodies are tense. All of our bodies are stiff at times. All of our bodies have things that show up on imaging results that will look like an abnormality, but we all have normal abnormalities. And a lot of times of that with migraine, there's so many presenting symptoms that are so unclear about what it may be coming from, that the approach in the medical community oftentimes can reinforce more fear over the symptoms and over the body. I know that that's what it was like for me. I even had family, because migraine runs in my family, and I had family members say, well, it's genetic, or you have to be careful because it could be more. It could be brain cancer. It could be something going wrong functioning wise in your brain. And if you hear that, you're like, oh my God, that's the most terrifying message ever. So every time you have a migraine or every time you experience one of the triggers, your nervous system is going to turn on. And right when we start to see some of that in this work of pain reprocessing therapy, we can already start to look at it through the lens of neuroplastic. Another part of this is that rule in method. We look at sensations that are triggered by innocuous stimuli, right? So things that might not be clear in nature, such as like being triggered by the sun, right? That was a biggest thing for me, is like the sun sensitivity was just so high on my radar when migraines were really bad. And the thing is that if you think about that in a lot of different ways, it can either be consistent or inconsistent, but the underlying message is that the sun in and of itself, temperature, sound, smells, these are all innocuous stimuli because they're around us all the time. It's just that our brain hyper focuses on certain things that trigger us, especially when we know that thing is going to lead to something worse, then to lead to a lot of fear, then to lead to a whole day or a whole week. It just continues to ripple from there, right? And so through our rule and method, understanding triggers, learned associations, and the anticipation of migraine, we can really start to look at this through a neuroplastic lens. There is physical occurrences of what comes from a migraine, as with other pain. Just like I have chronic hives, like you can see the hives on my body. You know it's there because it's from here down. But your parasympathetic nervous system is underneath that peripheral nervous system, that PNS, and that PNS and that CNS work together to send information to the brain and the rest of the body, right? And so when those two things work together, you will see things show up as physical and as the part of our brain that's sending us into a state of fight or flight. So essentially, every time you feel a migraine or the triggers around it, your brain's just doing its job. It's just like an overprotective parent where it's dialed up, and it's dialed up really intensely. And we have to learn to lean into that and figure out what is going on at a level that is actually manageable. And that's kind of what we do with migraine in this work.
Yeah, so we can't really give a blanket statement, everyone with migraine, it's all neuroplastic. It is individualized, and it takes a professional to help assess that. But I love, in doing my training with you, the idea that whether or not it is structural, or you have this for a reason, or it's exacerbated from, your preoccupation, whatever the reason, these practices and these skills are going to help you no matter what in helping you deal with the pain.
Totally. Like it's not going to hurt you to do this work, right? It doesn't hurt us to go, like, I wonder what it would be like to start being aware of some of my triggers and change the way in which I respond to them. I wonder what it would be like to recognize that, I can make some light changes to empower myself and feel less kind of tied down by this migraine routine, right? I mean, the work won't hurt you. It's just something to add to your repertoire of how you treat yourself, how you approach these sensations of migraine, and essentially like prioritizing this message over time that says, I might have more power than I think I do.
Yes. So in that vein, I think for many folks in the migraine community, we have historically felt that migraine has not been taken seriously, that it's a stigmatized disorder, even though, it is the third most common disease in the world, the second leading cause of disability. So kind of playing devil's advocate, and I think maybe a doubt for a lot of people with migraine, it's like, hey, I've been like fighting to make migraine like legitimate, and people to understand that this pain is real. Like, how do we kind of balance that with at the same time with PRT, we're trying to actually minimize our brain's interpretation of the threat, in another way kind of diminish the intensity. And I was curious if you could speak to that of simultaneously, like, yes, we want to advocate, like we want this to be recognized, but also, change the way we respond to the enormity of the problem of the pain.
Yeah. Yeah, absolutely. First and foremost, I tell folks to find someone that is sensitive and aware of the needs of migraine. Really important to build your support, right? Building your support with a community, making sure that the folks that you have in your wheelhouse of medical care or wellness care all can understand the impact of migraine, understand the triggers, and really support you, and leaning into your need to kind of back off of putting some more pressure on yourself to keep fixing it, right? Adrienne, you have our PRT directory link. I
Yes,
would really encourage folks to, really encourage folks to reach out to a medical provider or a clinician on our Pain Reprocessing Therapy Training Center site. There is a directory link. We are still building everyone on that list because we have our trainings, I believe they're every couple of months. And so, if there's not anyone in your area that you're able to see, please keep checking back. We've had a great turnout with medical providers and clinicians coming to us, such as Adrienne getting trained by us in PRT. So that list is still growing. So build your list, build your support of people who are sensitive and aware of these needs. And keep in mind, even sciatica, all pain comes from the brain. Something that I like to share that can really kind of even shed some light on that is a year ago, my significant other and I were in a motorcycle accident. It was not fun. It was very scary. But first of all, I realized how well I can respond to danger. Like, I didn't know how good I would be at it until a serious situation like that. Never again, but it was an interesting experience. And my significant other had never broken any bones, never been in any kind of chronic pain, doesn't really have anything like significant, consistent wise, like threatening him on a regular basis as I have. So we're quite different in the way that we're wired. And it was really scary for him to go through this time where so many things in his body were broken and needed a lot of patience and healing. And so we went to this orthopedic surgeon who didn't have the best bedside manner. And he was really kind of reinforcing a lot of fear, like, oh, you should have gotten a surgery by now. You have 1 week left to get a surgery on your collarbone or it's going to be ruined forever. And then if they have to go back in, they're going to have to re-break it and then attach like rods to it. And the look on this poor guy's face was just like devastated. And we left the doctor's office and he was like, I feel worse. Like, I physically feel worse. He felt his broken ribs, he felt his shin, he felt his collarbone, his body was fired up. And when he said that, I was like, there's really things happening in your body and you feel worse. That's interesting. And it's because these messages of fear were reinforced, right? And so I like to acknowledge that so that we know whether you do have a gajillion broken things in your body from this accident,
Yeah.
whether it's sciatica, whether it's migraine, all pain comes from the brain. And maybe this is also just my personality too, where I'm a very direct person. I'm a very direct clinician. I will even tell my clients, hey, I get it. You really want to hold on to really protective of the symptom of how it appears, and you really want to make sure that you're heard. I
Mhm.
hear you. I totally get where you're coming from, and we are very loyal to our suffering. So much so to the point where we just want to make sure that we grip onto it in the best way possible and that you hear us and you know that this thing is real. What
Mhm.
might it be like to just loosen that a little bit and just breathe into this new lens that goes, maybe I can change the way in which I respond to it. It
Mhm.
doesn't mean that I'm making it up. It just
Mhm.
means that I'm trying to approach it through a different lens.
Mhm. That's really
Mhm,
helpful.
mhm.
I know we got to wrap up soon, so I'm going to throw one question from that we got earlier, and then maybe wrap up with just the topic of triggers and like how,
Mhm.
as people with migraine, could we change our approach to migraine triggers? So
Yeah.
first, though, Sarah from our Yoga for Migraine group asked if neuroplasticity training is interrupting like the pain signals. Why does pain return after something like Botox injections? And so I guess it's kind of the idea of like, okay, well, we do have medicines to help. Like, how does this all fit, with neuroplasticity and
Mhm.
just how we experience pain? If does that make sense? How to respond to that?
It does. It does. I'll be super honest. I forget the specific properties of that of Botox injections, and I know that it helps. As I myself had tried that a while ago, but um,
Same.
the way that I understand it through my lens and through the work that I do is that everything that we use to help soothe our pain does actually soothe the primitive brain as well. Even the idea of like, I'm finally getting to my Excedrin and I'm finally getting to the thing that can soothe it, that already starts soothing our primitive brain, right? Think of it like a child with their security blanket. Does that security blanket protect them from the fear of the perceived boogeyman in the closet? Well, if the boogeyman is real, not really, but the child believes that that blanket is the thing that's really helping them. And like these things really help us on a level on which they do kind of navigate our symptoms momentarily. Like Excedrin works, but it
Mhm.
has a timer on it, right?
Mhm.
As do many things.
Yeah.
And we are trying to soothe the primitive brain foundationally, long term. We don't want
Mhm.
to put a timer on this work. All of our medications and the treatments that we do use, those have a timer on them. I used to go to the massage therapist regularly in grad school to help with migraines, and I could feel the timer in my body. Like I could feel the 2 week mark where I was not benefiting from the massage anymore, and I could feel my nervous system kind of already turning on in reaction to knowing like, oh, you're hitting that mark, you need to go back and get another massage. The massage helps, but it soothes the primitive brain, and it has like this timer on us, right? Just like other treatments that we utilize.
Yeah. And I've in my own training too with yoga, it's like the idea of we all have our own like natural pharmacy within us. And so
Yeah.
like this work is trying to boost like those natural things that help us feel good. While, obviously synthetic things do it in a different way. And this work is trying to boost the positive neurotransmitters that are going to help feel us
Mm-hmm.
better, help us feel better. Um, briefly, I'm going to say
Okay.
that to everything because
Yeah.
we got so much to talk about. But
I know.
what's wrong with just ignoring the pain?
Yeah.
Why do I want to focus on it? Won't it make me feel worse? How do you
Yeah.
respond to that?
Yeah. Again, it's kind of my personality. I'm like, sure, go for it. Try to ignore the pain. After a while, it's going to get really hard because your brain is asking you to listen to it. Your nervous system is turning on because it needs you to approach it like a lost child in a department store and soothing your nervous system in a functional, foundational way that helps you long term. So it's about recognizing that our goal is to let go of the bracing for impact,
Mm.
kind of exhale into the transition of what we're experiencing. We are so accustomed to bracing all the time. that we don't realize that bracing and ignoring is turning on our nervous system even more, which is even more telling your brain that you're in danger, which then reinforces that everything that you feel leading up to that is dangerous. And then you're getting stuck in this whirlwind of, oh, now ignoring isn't working and now it's backfiring. This work, the work that we focus on, really teaches you to exhale into the transition of the migraine rather than trying to get out of it. And we're just trying to teach ourselves that we can actually brace less, exhale into it, lean in, all of these messages that say, I don't have to fight this or ignore it or fix it. I can just teach myself to slow down enough so that I feel grounded, even when my body is feeling triggered.
That's a great explanation. All right, for real, I'm going to finish up with the last question here. So like we've talked about, I mean, nearly everything in our internal and external environment can be a trigger, right? The wind, the sun, the light. I mean, so people with migraine end up feeling like the whole world is a minefield. We're on constant high alert, and either we try to just limit our lives so much to avoid migraine attacks, or we feel like we're in pain and we don't want to go out. What is another approach? How would PRT perhaps approach this idea of triggers differently? Perhaps, getting to like the source of this, rather than playing whack-a-mole with all these other triggers in the world.
Yeah, absolutely. So I kind of said it earlier, but I'll go more into it, is this bracing for impact, right? We're changing the way in which we respond, and our triggers are often something that we're constantly bracing for. I was given a great piece of advice when I was in high school. I played rugby for a long time, and I was always like bracing for the impact of being tackled, and I got hurt a lot all the time. And I had my coach say, hey, I'm watching you brace before you even get hit, and it's turning you into like solid as a rock. And when you get hit, you crack down the middle and you get injured. I need you to be a little bit more like a rubber band. That's a wild concept to hear when somebody's literally coming at you. But a while later, I finally understood what he was saying. Being like a rubber band is about exhaling into the transition instead of bracing for it or leaning out of it. It's about recognizing that when something hits us, teaching ourselves to respond differently so that we can bounce back a little bit more like a rubber band, right? That's what reprocessing therapy does. That's what our work of changing the way in which we prioritize our day a little bit, those messages of safety, making some slight changes, exploring worst case scenario, recognizing that we're really preoccupied. All of these things are about just changing the way in which we respond. There are so many triggers. There's so many things to avoid. What if you didn't have to avoid them? Because what if they were actually things that were there that you could lean into instead of leaning out, right? And not about going, come on, son, I'm going to stare at the sun and make sure I don't get a migraine. It's more so about, no, if I have this sun in my eyes or in the peripheral of my eyes, which was my biggest thing, and I feel my body bracing, how can I teach myself to drop my belly, to recognize where the tension is building up, to prioritize my own messages around how this sensation and this trigger is actually okay right now. Worst case scenario, those are my fears coming up. I'm just getting preoccupied. And anything that happens from here on out, I will just lean in instead of lean out.
Love it. Well, Vanessa, I know we could talk for a whole nother hour, but I think our viewers just found this incredibly helpful. Viewers, if you're still with us, drop a comment. Like, what is your biggest aha idea that you gained from this? How are you looking at migraine and pain differently after listening to this? What questions do you still have? And I'm sure we can, try to address some of those later on. So if you are pumped, about PRT, Vanessa, where can people find you? I think we dropped the link for Pain Psychology Center. Where else can people find you?
Absolutely. I have my therapist Instagram. It's called That Therapist, that.therapist. So that is a place where you can reach me. I also, you can contact us through Pain Psychology Center. That will be our just kind of generic contact. There should be a contact option at the top. You can email or call. Our intake coordinators will receive that, and they will place you on our wait list that is currently about 1 to 2 months out. So that will be a way to get in touch with any of our clinicians here. I unfortunately am not taking any new clients, but like I said, I try to post regularly some things about traditional therapy, PRT work, and just other modalities that I work in on Instagram that'll help people feel motivated and supported and seen. So those are the options. Yeah.
Well, I have
Yeah.
learned so much from you, and even in this conversation, I'm just always gathering new bits of wisdom and just new ways to see our pain and feel like there is something that we have some agency over it, and rather than feel like, oh, it's our fault, that we have this, like, no, like we can do things about it. We can make changes that are gonna better support ourselves. So Vanessa, I'm so grateful that you came to share your knowledge and expertise and inspiration that we can overcome our chronic pain, we can live better, we can treat ourselves more kindly. So thank you so much for
Thank
your
you.
time today.
Absolutely. Thank you.
Thank you. And everyone else, if you are pumped about PRT and you're interested in working with me and what I do, I combine PRT, yoga, lifestyle, and mindset strategies in my group coaching program Beyond Migraine. And we have our next cohort starting in August. So if you're interested to learn more, feel free to send me a DM. I'll drop a little link to book a free call with me. But thank you everyone for being here, and we'll see you next Wednesday. Bye bye.